unfortunately, diabetes is quite common in the elderly. The risk of developing diabetes increases significantly as a person ages. So about 25% of the people who are 65 years old or more have diabetes, and another 25% of the elderly have what is called prediabetes, which is a condition that in many cases eventually develops into diabetes. So if a person is 65 years old or more, they have about a 50% chance of being diabetic or pre-diabetic. So there are many reasons why as people age, the risk of developing diabetes increases. One important reason is that often as people age, they become more overweight. So being overweight increases the chances of becoming diabetic, and aging often is accompanied with becoming overweight and frankly obese. Also, people as people age, also their activity levels tend to decrease. So during their daily living activities, often they do less physical activity, but also routine exercise and physical training programs are less common in the elderly for different reasons. So becoming overweight and less physical activity are very important reasons why older people have a higher risk of developing diabetes. However, aging itself, even if a person is not overweight and is physically active, they have a higher chance of becoming diabetic just because they are getting older. So many of our patients that of our elderly patients that have diabetes are not overweight and do exercise, and that is because aging itself can increase the risk of developing diabetes. And there are a couple of reasons for this. One is that the cells that are responsible for producing the hormone insulin become less able to function properly with aging. That is one reason. The other reason is that our body in general becomes less capable of burning the sugar and the nutrients that we eat as we age. So our muscle tissues, and which is the main tissue that burns the sugar, becomes less efficient to burn it as we age.